Just about 30 seconds or so before I open. Oh, it's 9 o'clock now. Are you ready?
Ready? You want to let him in? Yeah, go ahead. Good morning, everyone. Good morning. Come on in. Good morning. Good morning. Everybody's filling in. We'll wait just a few minutes and then we'll get started. Good morning, and welcome to ICON. I cannot believe it's Friday. It was a fast week for us. I figure it was a fast week for all of you as well. We've got a few more people joining from the waiting room. It always takes a second. So we'll go ahead and let them get situated. While we're doing that, I'm going to just take care of a few housekeeping notes. You all are pros at Zoom by now. If this is your first run at ICON, we do things a little bit different here. We'd love to see your face. So it's okay to keep your black screen, but man, we'd love to see your face. So please be sure to turn on your camera if you can. We get much better connections when we can see you. A couple other notes. You may have seen a little note when you came in that says this is being live streamed. When you come to the main room, you'll note that that is actually closed captioning. So if you're visually impaired or audio impaired, we do have closed captioning available in the main room, and that is what that live stream is all about. It is being recorded, so you will see and be able to see these sessions again on YouTube, perhaps as early as next week. We'll see, but they will be up again so that you can watch them again. So I think that's all the housekeeping. We hope that you raise your hand either just like this, or if you can figure out how to put the electronic hand up, that you do that as well. So whichever way you're most comfortable, I hope that you will participate, because that's what today is all about, participation. All right. Well, without any further delay, I want to welcome you on behalf of everyone at Livestrong, not only to ICON Summit, but to Livestrong Challenge Weekend. This event kicks off a really big weekend for us here at Livestrong. For the past 25 years, Challenge Weekend has really marked a time when cancer survivors, caregivers, family, and friends all come to Austin to honor, remember, and celebrate those who have faced the journey of cancer. They also fundraise, and they do that so that we can invest in solutions that make the quality of life just a little bit better for those facing the journey, because it doesn't have to be so hard. Now, someone has to lead that effort, and it is my honor today to introduce to you our CEO, President, cancer survivor, cancer caregiver, and someone who's been a part of the Livestrong team for over 15 years, Greg Lee. Greg, the gallery is yours.
Thank you very much, Suzanne. I'm going to take a minute to work on sharing my screen and just realize that as I screw this up, just bear with me as we get going, and we'll try to get that done the right way. And if I mess it up a time or two, then we'll do that. All right. I bet you're seeing what I'm seeing now, which is terrific. First of all, before we jump into more details, I want to say thank you. Thank you to our sponsor, Genentech, for all you've done. We've been a terrific program partner of ours for years and years and years, and we really appreciate your investment in the work that we continue to do on behalf of cancer patients and constituents around the world. It means the world to us. I also want to say a special thank to our speakers, our presenters, for taking additional time and sacrificing and investing your energy and your efforts and your stories with the rest of us so that the cancer community can benefit from your experiences and your knowledge. And then finally, I want to thank you, the participants, for joining us today. And I'm also going to thank you, but I'm also going to encourage you. In the last month or so, there have been some ventures that have gone out into space. And people have strapped themselves into a rocket and taken off. Most recently, Captain Kirk, I think earlier this week, went on a journey into space. And I will tell you, I heard long ago that the world is made up of two types of individuals, astronomers and astronauts. And today I'm going to encourage you to continue. And quite frankly, just by your presence today, you're already on this journey. But I would continue to encourage you to be an astronaut. Astronomers look at things from afar. It's really cool to see. It's fun to experience. But as I'm sure you've heard passengers and folks that have gone on these recent space journeys talk about, there's nothing quite like strapping yourself in or being a part of that and blasting into space and engaging and really soaking it all in. And so thank you for your presence today, because in my mind, you are already on the journey to be that astronaut, and continue that journey on our behalf. Thank you for being here. Just understand we are listening. Your voice is being heard. For nearly 25 years, we've done really that. We've listened. We've thought about your ideas. We've taken your thoughts and your ideas, and we've used those to create meaningful programs that will provide lasting impact to the cancer patients and cancer survivors and cancer caregivers and the medical profession itself. Without that input from you, without that engagement from you, the robust nature of our programs just isn't what it is, and we would never have been able to accomplish that. But we've done this for literally 25 years, and we thank you for that. During that time frame, we've reached and engaged with literally more than 106 million people around the world, either through our programs, our social media offerings, our newsletters, our other platforms. We've been able to reach people all over the country and all over the world. In addition to that, through our services, our navigation services, our Help Starts Here programs, we served over 9.3 million people. And so you ought to be proud of the work that you have helped us get done. In addition to that, we have also saved families a huge chunk of money, north of $87 million. Keep in mind that, we want to provide emotional support and answers to their cancer-related questions and solutions. But along the way, if we can find ways to provide financial assistance and or connect them with providers or service providers or helpful hints that will save on their healthcare dollars, we want to be able to do that. And as a result of your investments with us, we've been able to do that to a great extent. We've taken those funds and we've invested literally more than $580 million into cancer programs and initiatives around the globe. Most of those are aimed at taking direct aim at gaps in care that we see, that are identified literally with your solutions and your input that we provide in ICON conversations just like this. You should also know that this year, not just historically, but this year, we've served over 104,000 people. We've saved families more than $6.5 million. We created the Livestrong Cancer Institutes and launched that here in Austin, Texas. To date, that has served almost 1,000 patients in 58 different cancer areas, which is a phenomenal thing considering COVID and the restrictions that are in place there. In addition to that, we started a new initiative with Suzanne's leadership and help, developing what we call a cancer market network. It is a hub and spoke model to really be a central place where cancer patients, cancer caregivers, providers, can all come together to learn and share more information about their diagnosis and about their journey and how to get that assistance. We're working as feverishly and as fast as we can to get that developed and be ready to launch. So be on the lookout for more information about that. But we're excited about the opportunity to really share that with the world and find a way to scale the work that we've done in survivorship and navigation over the years. As I mentioned, all of this is aimed to address gaps in care that really make cancer harder than it has to be. And our whole effort is to try to find solutions to the practical problems that we all face as we go through a cancer journey. We're glad you're here. We're looking forward to that. We've got a full agenda today. We've got updates from partners. We have currently invested in a little bit more than 590 partners around the world. Some of our current partners that we're going to hear from today, the Pavlov Foundation, Wonders and Worries, hear an update from Vital Hearts and Big Love Cancer. Also going to hear a little bit about the program from Emilio Rides, Plant Powered Metro New York, and the Breakfast Club. We wanted you to get a very good update on the programs that we're currently providing funds to, how those have been working, and the results that they're seeing, so that you understand a little bit more about the work that we're doing behind the scenes. As we look forward to the future, we want to continue to get your feedback and your input and your guidance. And there are three major areas that we're going to talk about throughout the day. One is equity in cancer care. It is really a moral dilemma if people are not in all walks of life receiving and having available the type of cancer care that can make their journey easier. We want to understand what those roadblocks, what those speed bumps, and what those barriers are, and do our part in trying to eliminate those barriers to improve health outcomes for all. I think we all realize the mental stress and exertion that it puts on individuals and families to go through a cancer journey. A cancer journey is usually very long and very protracted, and it kind of beats you up mentally from all angles. And it just doesn't impact the patient. The caregiver is often stressed to the max. Family members who hear limited or only updated information very infrequently may be going through stresses. Adults and children go through different types of mental fatigue. And so we want to understand those and get some ideas and thoughts from you on how we can do that better. And then, as you know, we have always believed that a solution toward cancer is holistic, that there are ways to make your cancer journey better. And it's not just understanding how to navigate the system, but it involves things like nutrition. And what are the secrets and helpful hints that you can have to really provide your body with the fuel to be able to fight this crazy disease throughout your journey? And so in each of these categories today, we have a series of great speakers that are going to talk a little bit about this. There's going to be facilitators that help talk about ideas and thoughts on how to solve this. And so we really want to hear your voice. We really want to hear what you're talking about, what the ideas and challenges are. And so again, I encourage you to be that astronaut. Jump in, raise your hand, punch the flag button on your computer, and provide us that thoughtful and meaningful information. We also thought that it would be great just to hear some terrific speakers that are talking about innovative ideas. So we're going to hear some from startups that are literally changing the world and how they're doing that. There's going to be some conversations around recent topics about fertility surrogacy. We have a great presentation that talks about the LGBT community and the cancer in that community and the challenges and the things that face that community. And you're also going to hear in kind of a Q&A with Bill Bromell about Can You Hear My Voice? I'm excited to be a part of that. I hope you all had a chance to view and listen to the video that was sent out earlier. Means an awful lot to us, and I'm anxious to hear that presentation later on. We got a full slate ahead, and you didn't come here today just to listen to me. I hope that I was able to provide you with a quick summary of what we're trying to do today, and thank you for all the great work we're doing. Again, strap yourself to that rocket today. Let's all be engaged and have a great summit. Thanks again so much for being here and being part of our Livestrong community. Back to you, Miss Suzanne.
Thank you so much, Greg. Thank you. Okay, everyone. Well, you hopefully have already set your schedules in Sched. So if you haven't, just a little primer again, you're going to go back to Sched and you can click on any schedule that you want to, and then you'll find the link for that session in Sched. So last year in Summit, the only negative feedback we got was that I didn't give you enough break time. So I've built in breaks this time. So you've got a few minutes before your next session, so go fill up your cup of coffee. If you have any questions, please feel free to message us. You've probably seen Brittany. Brittany, raise your hand and wave. If you've had any technical problems, you've already spoken with Brittany, so she will help solve them along the way. We are very excited and very honored to have all of you here with us today, and really excited to have a lot of amazing speakers. So I will see you all very soon. Go check your Sched. You can log on to the next Zoom panel, get your coffee ready, and we're going to start our great day. Thank you guys so much, and we'll see you in the next session.